Hi, I'm Dr. Gary Breslow. I'm the Medical Director of the Breslow Center for Plastic Surgery and Injections Medical Spa. Today we're here to talk about frequently asked questions with breast augmentation. A couple of things about breast implants that everyone should know. There's different types of implants. There's saline-filled implants and there's silicone-filled implants. The saline is actually clear. This is actually an antiseptic saline that we use just for display purposes. Saline implants and silicone implants are both made of the same shell. Saline comes empty and it gets filled during surgery with saline. Silicone comes pre-filled. So at the time of your consultation, we have patients go through a sizing process where we have patients put on different sizes to see which one is the size they like the best. And then what we do is we take the number that the patient chooses and we have 3D imaging, and we are then able to show the patient what they could look like with that size implant. With respect to which implant is the right one in terms of saline or silicone, most women nowadays choose silicone because they look and feel more natural. So a question we often get asked is how often do breast implants last? So short answer for how long do implants last is they're supposed to last forever. That said, there is a 1% per year rupture rate. So in 10 years, 90% of the implants are fully intact. If saline ruptures, it's just water in a bag, it deflates. If silicone ruptures, this is a silicone implant that I put a knife through, it doesn't go anywhere, it's like Jello. So it's also called cohesive gel. So as a result, you may not know that it was ruptured. So with silicone implants, there's a recommendation, not a requirement, but a recommendation by the FDA that after the first 5 years, you get an MRI, and then every 2 years thereafter, you get one as well. It's not a requirement, and what we basically tell patients that if you get silicone implants, which most women do, in 10 to 15 years, you should either get an MRI at the latest, or proactively get them replaced. A question we often get asked is how long does the procedure take and what's the recovery time? So the procedure itself for a breast augmentation usually takes about an hour and a half. It's an outpatient procedure. You go home that day. You will be in a surgical bra for a few days and then a sports bra for 6 weeks. We don't allow our patients to drive for a week. We don't want too much movement of their arms. All the sutures are dissolvable. You'll have surgical glue that comes off at 2 weeks. We have you start doing massage at around a week or so. And as far as the recovery time, it takes about 6 weeks for the implant scar capsule to form. We don't let you work out with your chest for 3 months. And the scars take about a year to a year and a half to fully mature. So by 3 months, you're pretty much where you're going to be in terms of seeing your results. And then really it's just scar management at that point. So patients often ask, can I breastfeed after augmentation? So breast augmentation doesn't really affect the breast per se. The implants get placed under the muscle. When we make the incisions, the 2 incisions we could use are most commonly at the base of the breast or at the inferior part of the areola. When we go at the base of the breast, we actually don't even really see the breast tissue because we go under the breast tissue. And when we do it at the base of the areola, we just go through the breast tissue to get to under the muscle. So in each case, the ducts are not being affected. So the breast augmentation should not affect your ability to breastfeed. So the question we get asked often is how long do I have to wait until I see the results of breast augmentation? So I always tell patients not to look at their breasts for the first 6 weeks. The breasts are going to look a little bit high at first. We generally have you do massage to the breasts. There's different types of massages to help put the get the implants into the position that we want. But it takes about 6 weeks for your body to form a scar capsule around the implant to support the implant. The other thing that we generally use in patients for breast augmentation is this product, which is called Galaflex 3-dimensional mesh. It's a pretty remarkable product that we were using for a long time for breast reconstruction, and now we use it for augmentation because the results are so good. It's also called the internal bra because what it does is it basically provides support for the implant. It's an absorbable mesh. It's made of the same material as absorbable sutures, and it gets replaced with scar tissue over the course of about 18 months. And what it does is it helps achieve very nice natural results and makes the breasts look perkier because it provides support. But I would say by 3 months, your breasts are pretty much going to be where they're going to be. So another question that we get asked is how soon before I can exercise? So the implants get placed under the muscle for a variety of reasons. They look more natural, they feel more natural. decreases the risk of something called a capsular contracture. When you place them over the muscle, the risk of capsular contracture, where the body forms a scar capsule on the implant, it distorts it, is very high. It's very low when you go under the muscle. So for that reason, we limit chest activity for 3 months after the surgery. We allow our patients to start doing light exercising. Usually after a week, they can start doing some walking, and at 2 weeks, they can start resuming activities in terms of jogging, and they can progress to abdominal activities and arm activities, but again, no chest exercises for 3 full months, because that can increase the risk of implant moving and also increase the risk of capsular contracture.